Hey everybody, Judy Seeger here, and welcome back to the Ozone Summit. As you know, we have professional ozone therapists from all over the world doing all different kinds of therapy, and we're so happy to have you back on. And this time we're going to be talking with Dr. Margot Roman, who is a veterinarian who's been using ozone therapy for a long time, like about 15 years or so, teaching people, and just the best. I always get you guys the best, and this one is one of them. And what we're going to do is Dr. Roman is going to talk about all kinds of things that she's found has been very, very effective in her practice. And we got some other bonuses we're going to include from people that have actually been in her clinic and how their animals are benefiting. And I'm really excited to see that because we don't have a lot of videos on that. So Dr. Roman is kind enough to have some patients who are willing to do that, or clients with the dogs for the patients, right? So we'll get that going. Dr. Roman, so happy to have you on. Thank you for being here on the summit.
Thank you very much, Judy. And I'm excited that you're doing something on ozone for our clients. You know, the patients obviously aren't watching this, but hopefully the human patients are watching it. But
yeah,
ozone therapy has been one of the biggest additions to my practice, and I've been doing integrative medicine for almost 40 years.
Wow, that's a long time. So Dr. Roman, let's go down to the basics first, because time flies always as we're doing this, right? Let's get to the basics because we're talking to people who are not real familiar with ozone. So first of all, in your own words, why don't you explain to us, what is ozone?
So how I interpret ozone is that your body needs oxygen to run the mitochondria of the cells. And when you use ozone, you're increasing an oxidative stress, which is also putting a lot of oxygen into the tissue. And that allows the mitochondria to actually start to function. And since the mitochondria are the batteries of the cells, and 10% of our body weight is mitochondria, what is the first thing that we should try to do is to stimulate our own cells to do the right thing and start to protect itself. So by allowing the cells to function more efficiently, the immune system starts to work. And so I find that ozone is one of the best ways to get the cells to actually work well. And there's so many different ways that we can administer it, and for so many other reasons in health and animals that are unhealthy, what can we do to start getting their own immune system to work?
Right. So that's a great explanation. And you kind of hinted, and I want you to go into that. How are you using it in your practice?
So in my practice, well, I first started using it because I had my own horse who had cancer, and I had tried a lot of holistic support for him. And for about 6 years, I managed him pretty well. And then I took him to the veterinary school at Tufts, and they told me he was dying. He would be dead in 3 days. And I could not give up on him. And I had started doing ozone, but I wasn't doing it as actively as I could be doing it. And so I basically was convinced by 2 other friends to just do intravenous ozone on my horse. And he lived 2.5 years after the veterinary school said he was dead. And so when you love somebody so much that you're willing just to try things that that are out of your comfort zone, because you feel like you have to there's got to be another way. They can't be just euthanize your animal, which is what a lot of vets basically shrug their shoulders and go, I can't think of anything else I can do, so you have to euthanize your animal. Instead of stepping out of their comfort zone and out of their box and looking at other alternatives that they can do to help the immune system get stronger, that's what I did for my horse. And it opened so many opportunities to help other animals and to learn more. And as I tried to learn more, there weren't any classes on veterinary ozone. I was just sort of pulling things from literature from overseas and trying to figure out what the Spanish literature and the Russian. And now there's so much wonderful information that we can share. And I appreciate that you're trying to get this out to the English-speaking public, that this is a really important piece that we need to be using on our animals' health and our own bodies as well.
Right. And in the summit, we're talking, of course, to people who want to use it for themselves and their healing journey, but also for people who are interested in dentistry. But this whole veterinary area is really even more in the dark, unfortunately. So we're really trying to bring it out to the light. So I appreciate your sharing, especially because you've been at this for 15 years or so. And isn't it interesting is because you went through something in your own life with a horse that was so dear to you. And I love horses. I've had horses myself, that you're attached and you want to help them and you found something. So that was beneficial for your loved one. How have you found it beneficial in your practice as you've been working with different animals? Because you do all different animals, right? You do small. Do you also do large animals?
No, I only really did a few horses with the ozone, but that's because my specialty is small animals. So I've been doing integrative medicine close to 35 years, but I've been practicing about 40 years. And it was always sort of downplayed in my professional conventional life that it's really ridiculous. Why are you doing this? You're wasting your time. You know, voodoo is acupuncture. It's just, there were so many prejudices from the conventional side. But the ozone, the reason I use ozone is I see amazing changes. People would call it magic juice. And we ozonate saline, and we gave ozonated saline as our delivery system. And that's how I've been doing it after Lyle Hassel, who was an engineer who helped work on ozone for animals. And he's since passed away, and he spent hours and hours and hours trying to talk to me on the phone on how to do ozonated saline and how to do all these procedures. And I thank him very much, because I wouldn't have had the confidence to keep trying some of these things, because there's no one else I could look to give me advice. And so when you did it, and it was like, oh my God, that's amazing. The animal's out of pain. The infection went away. The cancer is not growing any larger. What was this? Was this all, coincidence? Was this all anecdotal? Well, according to my conventional colleagues, it's all anecdotal. But when you see it over and over and over and over again, you say, okay, we've got to start getting this out to the public, because they need to have this tool that is not hard to do. It's not really expensive compared to CAT scans and radiation and chemo and surgery. So why not do something that supports the immune system, and at the same time be nurturing the immune system so that it can help make it fight its battle? We've included a lot of nutritional supplements and other, herbs, and as well as homeopathy, and if we need chiropractic and acupuncture. So we're putting a whole package together. But the ozone is part of the support. And so by having the oxidative therapy like ozone therapy, hyperbaric oxygen is wonderful. And I have a hyperbaric chamber, and I love that chamber. But the ozone is so much more cost effective, and I think does actually even a better job. It can be directed in an area where you really need it versus the whole body, which is wonderful to do the whole body, but you can do the whole body with ozone as well. But it's cost effective for both the veterinarian and the client who can utilize an ozone machine, whether it's in the practice or outside the practice.
Right. And I had a clinic where I had a hyperbaric as well, and I like the oxygen or the ozone therapy better. I agree with you 100%. So walk us through, I know before we got on the interview, you had one large animal that you're working with, but walk us through, because you said you do IVs, and yet you said people could do this at home. So let's talk about both, right? So in your clinic, walk us through some animal that you've worked with either recently or the one that you just had on, and explain to us what the process is and how you do that whole thing, and how does the animal feel like? Do you see the differences right away? What do you notice as you're working with them?
So the animal that was just in that we didn't film is a Leonberger with osteosarcoma in the front paw. And that's a pretty serious injury, not serious injury, serious disease. He's only 5 years old, and so that's sad because, it's a young animal, but the cancer means either amputation or radiation amputation, chemotherapy. And the owners have decided they wanted to do more alternative support, and they are doing some conventional support. I wouldn't say support, so conventional treatment as well. So he today got ozone with ultraviolet blood therapy. So we took a percentage of his blood out and mixed it with ozonated saline, added a product called Biocean, which has all the trace minerals in the bottom of the ocean, mixed that together, and ran it through ultraviolet light 6 times, and then gave it back to him intravenously.
So it's like a tube with a machine that goes through that the ozonation process is going, correct?
We use ozonated saline, and we use ozone 2 as well to ozonate the blood, and then we run it through ultraviolet light. And so the idea is that the ozone, first of all, kills bacteria and fungi and probably the cancer cells, and so does the UVB. And then we're giving it back intravenously. And I look at it as being almost like a self-vaccine for the animal. It's like killing things that are because the body,
But in a healthy way, yeah.
in a healthy way. So it's killing things that are negative within the blood, supporting the healthy cells and mitochondria of the functional good cells in our body, but killing the cancer cells that don't like oxygen, that like fermentation, like higher amounts of carbon dioxide. And then we're giving it back intravenously back into the animal. And I think it just sort of spikes the immune system to sort of, whoa, let's do something about this. You know, let's get that process moving. So we did that to the dog. We also gave the dog some subcutaneous ozonated saline because this was a 170-pound dog. So you said it was a large animal. It's a dog still, and he's considered a small animal, but he's a large, small animal. And so we gave him that. And then I'm trying something that I had not really done before, was I'm injecting into the cancer as part of his foot, at his carcass, above his carcass, ozone gas into the cancer itself. And we're doing that because we know that ozone will kill cancer cells. But also I went to a conference this past August in Brazil. And Brazil is way ahead of us when it comes to ozone therapy and veterinarians. They brought ozone therapy there in 2011. There are now 800 veterinarians, including ozone in their practices in Brazil. I am just so excited. In this country, it's a lot less. In Japan, there are now 300 veterinarians that are utilizing ozone therapy for their patients in Japan.
So obviously they're doing it because they're getting success, and that's the whole deal. Their government is allowing it, and because they're seeing the success, and the animals, of course, are getting better. So that's exciting that Brazil and Japan, I didn't know that.
And what they did in Brazil, someone presented a lecture, and they showed non-union fractures with plates that had been for 3 months, and they said, you got to amputate this dog's leg. It's got osteomyelitis, it's infected, the bone won't heal. And they took the plates out and they injected ozone gas directly into the fracture sites. In 2 weeks, it was completely healed. And they have the x-rays to show it. So if you can get oxygen to kill the bacteria overgrowth that's present, and in this case, I'm hoping that it kills some of the cancer that might be there, and it strengthens the healthy cells that are there. That's my attempt on this case. Will I be successful? I don't know. He feels good. He's acting good. He has had 2 other, conventional procedures done. And so we're trying to do an integrative approach to this type of cancer. So the owner now finally has gotten an ozone machine and is doing it rectally. And that's who hopefully will give us the video to show how easy it is. When they first were talking about doing it, it was very like, this is too hard for me to do. I don't think I can manage it. The same issue happens with veterinarians. They hear the word ozone therapy. They think it's so complicated. It's not. They learn this procedure. I teach the accredited course in the United States, and we're going to have some online training courses for veterinarians. So lay people listening to this can encourage their veterinarians to say, this is something that it's not expensive. It's very supportive. Why can't you have this as part of the care that my dog and cat get in my practice, or my horse if you're an equine owned horses? So they're encouraging owners to be empowered to speak to their veterinarians and say, I would like to have this done. Where can I have it done? And they say, well, we don't know anything about it. Well, maybe you should learn about it. Maybe this might be something that might.
Well, that's always a process, right? I know, it's always a process. So going back to when you're doing it in the clinic, are the animals immediately seeing an effect after you've done the ozone?
Sometimes you do. Sometimes people, like I said, call it magic juice, where you put ozone over an area that's painful, and then suddenly they're not a pain. So if that's positive, it's a real positive thing. If there's an infection and you flood it with ozone and you do the UVB, and then the abscess and the infection goes away the next day, that's a sign of success, I think, because
for sure. What's the UV? So I understand it, but for the people who are watching, the UV, the ultraviolet light, what is the purpose of doing that?
Well, because the ultraviolet light stimulates the cells. It's photonic activity for the cells. So the light stimulates cells, but it also like we know that if you run ultraviolet light, it kills certain bacteria. We know that. So that is what we're trying to do, is to kill some of the bacteria, stimulate with light the cells within the blood, and then the oxygen's doing a similar thing. So I think it's like a bang bang kind of push up, move it up up. So I think ozone is wonderful, but I think if I'm really trying to get deeper, I add the ultraviolet light therapy, especially for infections and for cancer. I think
Well, and then when you mentioned that they could do it at home, so let's walk that through for a minute, because a lot of people are thinking, how are they going to put it in the dog's butt, and how is that dog going to handle that? I mean, people already have a hard enough time. I know they give me a hard time all the time. How would you do that? Like, is it just you have them laying down and the owner puts it in, or is there sometimes a little discomfort?
Well, again, I think it's important to work with an integrative veterinarian that understands the components. It's not just only ozone. I think there's a big part that nutrition has to play and other support for the body that, the ozone is just one component of it. So, just doing ozone and not doing, it's like, doing ozone and smoking all day, you're not going to help yourself.
Which is exactly what I say all the time. It's not a magic bullet, but with a multifaceted approach, you get such better results. So I'm really, really glad you're saying that, Doc. That's very important.
If you can enhance, if I feel it potentiates what I do. So if I do surgery and I'm doing an intussusception, or I'm doing any kind of bladder surgery with stones, and I use ozonated saline to flush the bladder after surgery, and so that I'm getting the effect of ozone as well as I would normally just put saline in there, but put ozonated saline. And I have, videos of these bladders that were very red and, beaten up, and they've got the incisions in them. You dilate the bladder with ozone, and all of a sudden it's just perfectly pink, like it was never had surgery on it. So if you can see that happening in your eyes, right in front of you, what is it happening if you can't see it going into the body? So those are different ways of doing it that obviously, the owner is not going to be able to do those procedures. But rectal insufflation or subcutaneous fluid insufflation, or fluids, is something that most clients could do. The rectal insufflation is basically like putting a thermometer up their tush, but it's a catheter, and you're going to be pushing it up higher and then injecting air through the ozone, not air, but ozonated oxygen into the rectal catheter, and then pulling out the catheter and sticking his tail between their legs so that it holds it in there. You can also do it vaginally like that with gas. And so there's many ways to use the gas. We also bag limbs with it and bag the whole body too as well. I use a lot of olive oil going through the olive oil so that it forms ozonides, and it can actually not irritate the lungs, because the gas is irritating to the lungs. So you want to make sure that you keep it inside the rectum, it doesn't come out, and you're breathing it. So there are some precautions that I try to get people to be aware, that you don't want to breathe ozone.
Yeah, that's what I tell them too. I have the fan going all the time, the windows open, or just things like that. So it's only a few minutes rectally. That really doesn't take much. But do the animals kind of fight it a little bit, or are they pretty good with it?
A lot of animals don't like their rear ends touched. I mean,
yeah.
It's so hard to even get a temperature on them. And it is hard on some animals that you can't manipulate them, because they just don't want you to touch them back there. But if
so the better way is for them to come into the clinic, try it out, see how the animal does, and then if they're okay with it, the owner could take them home and do this procedure. Yeah.
Right. And I use an aloe gel instead of any kind of petroleum. I don't want any petroleum in there or anything that would be a negative thing to go in. So I use aloe gel to lubricate it. We do a lot of fecal transplants at my practice. So we call it microbiome restorative therapy. And the reason for it, and it goes so well with the ozone therapy, is that if 85% of your immune system comes from your gut and from the inner relationship of your microbes, then what's the most important thing that you can do for any individual is support the microbes of the gut. So all the new science that's out there, in 2001, there was one research article written on microbiome. In 2016, there were 7,128 articles.
Wow, that's a huge increase. Oh,
Huge increase. I'd love to see the same thing in ozone therapy, because once people see the benefits of a process or procedure, or in this case, it's actually almost an invented new body part. In 1950, the parathyroid gland was the last organ system identified in the human body, and they're calling now the microbiome an organ system. So in 2016, or 2015, 16, that's like 55 years, 65 years that a new organ system has been understood in the body. So the microbiome is so I use ozone to reduce the biofilm of the gut, because we have a lot of biofilm that develops because of overuse of antibiotics that causes C. diff, and people get infections, they can't get rid of it. Use ozone to reduce your biofilm, and then you put the new microbes in, or you help introduce new bacteria through other methods to help the gut reestablish itself. So ozone to me is a key component to that. Otherwise, in conventional medicine, when they do fecal transplants, they put them on more antibiotics. They put them on vancomycin and vancomycin and metronidazole. So they put them on two antibiotics, vancomycin and metronidazole, to kill the gut. I don't want to kill the gut microbes. I want to get rid of the overgrowth, and that's what the ozone would do. And at the same time, what it's doing is it's stimulating the stem cells of the colon. As I mentioned before, ozone has an affinity with mitochondria. So when the oxygen and ozone goes to mitochondria, the cells in the colon that have the most mitochondria are the stem cells, and they are at the base of the crypt of the colon. So those new cells that are coming up are getting more oxygenated. They have more battery power within the cell. And then some of the oxygen and ozone is going through the caudal mesenteric vein, which is the main vein of the colon, and it goes to the liver and detoxes the liver. So you've got this triad of benefit, reducing biofilm, stimulating stem cells, and allowing it to go to the liver and detox the body.
so the challenge is these poor animals are having a lot of gut issues like humans. Is it because of the food they're eating, the stress, the type of food that they're eating off the table of their owners? Like, what's the issue? Like, I'm very surprised that so many animals are having so many problems with their gut. And I mean, I see it all the time, of course, with humans. What do you think is the root cause of that?
Well, when we look at what we feed animals, the dog food that we buy commercially is not something I would feed any of my dogs. I just haven't fed commercial dog food in 25 years to my pets. We know that glyphosate, which is, glyphosate is Roundup, and Monsanto produced Roundup, and it's used as an herbicide to prevent wheat. And what happened is it's become so proliferative. I mean, it's just everywhere. It's in every food substance that we use pretty much. It's grown with our corn, because we have Roundup ready corn and soy and wheat, and it is not something that you want to put into your body. They wanted to come out with Roundup as an antibiotic for the intestinal tract.
Isn't that crazy? That's insane. Chemicals to help heal? That's like, no way.
So if you're using this product because you don't want weeds, what are you doing to the biodiversity of your soil? You're killing it. You're damaging it. You're doing the same thing to your gut. So if you're feeding all of the farm animals that most the cows and the chickens and the corn, or the pigs, and even the fish that are grown in farms, is fed GMO corn, soybean, and wheat products. So if you're feeding glyphosate to animals, what do you expect the quality of their gut microbiome and their health?
Right.
To me, that's pretty bad. So if you're using that for their food, and then you're using that to make dog food, and then you're using all the parts of the animal that are not fit for human consumption because they either have cancer or they're tainted, and you put that into dog food, when you're feeding animals that, what do you expect to gain in the immune system of the dog when you're feeding things like that? So it's a consciousness of, of knowing about other ways to feed animals, to be conscious about it, to understand the life, where the highest on the food chain is. The higher on the food chain you are, the more toxins you're going to accumulate. So feeding as low on the food chain as you can, using more healthy plant-based, non-carbohydrate products will help animals stay healthier. So we want to be able to, find sources that don't have a lot of contamination. And you know what? They aren't around anymore. We don't have them anymore. Even, grass-fed beef is not clean anymore. Even the deer that are hunted are running through people's yards and eating Roundup grass.
Or corn. Yeah, it's everywhere. That's the problem. It's just hard to get away. That's why I agree with you 100%, Dr. Roman, that the ozone is necessary, or things like ozone and supplements and whatnot, because you can't get away from it. It's everywhere. We need help now to get rid of it.
As clean as you can, but we live in an environment that 100 years ago was not like what it is. And I don't really know if you remember Al Gore's movie.
I do.
You remember there's a scene where he shows you where the CO2 levels were in the 60s with one of his professors. And then they have core samples of glaciers that they took years before. And they looked at the carbon dioxide levels in the environment earlier in civilization to where it was in the 60s. And they kept measuring it. And every year it got higher and higher and higher. And there's a scene that I remember really clearly where he's on a cherry picker. And he says to everybody, this is like 14 years ago, this is where we are now. This is where we're going to be in 10 years. And he goes off the screen. That's where we are now. So if we live in an environment that is so much higher in carbon dioxide due to global warming, which I believe is science and is there, and how can we stay healthy anymore? We live with this high carbon dioxide amount. So by allowing the body to be less stressed with toxins in the environment, eating foods that provide more vital energy to you, or vital nutrition to you, instead of lots of processed food, but lots of organic fruits and vegetables that are not tainted with a lot of glyphosate or other things. We're giving our body more ability to take care of itself. And then on top of that, if we are challenging ourselves living in cities and living in homes where we're not opening windows and getting a lot of oxygen, and in our homes we use chemicals to clean our floors and our counters that are toxic as well, we're not allowing that animal to get exposure to the natural environment, which is what they were brought up for millions of years, well, maybe not millions, but hundreds of thousands of years, that these animals have lived in those environments. And we live in confined spaces, and these animals don't get enough exercise and oxygen in their bodies. And so they're starting to deteriorate a lot sooner. So they're the canaries in the coal mine. They are aging 7 times faster than we are. So if they're aging 7 times faster, and over 50% of dogs are getting cancer, this is a big alarm system.
Wow, wait a minute, 50%? 50% are going and getting cancer. Wow, that's a really high number. I didn't realize it. And that's dogs or cats, or what is that?
They said by 2020, which is pretty close, 50% of dogs are going to have cancer.
Wow, that's a lot.
15 years ago when we made this statement, it was 46% of dogs were getting cancer.
Yeah, so it's steadily climbing.
It's getting there. And in my practice, that is the biggest. The 3 things that really get me in my practice is cancer, Lyme disease, and kidney failure. Those are the 3 things that are so damaging to the, when somebody loves their animal so much and wants to do as much as they can, their animals are either dying from cancer, they have chronic Lyme disease and are constantly having pain and infections, or they have kidney failure. So those are the 3 biggies that are attacking the veterinary profession. When I started practicing 40 years ago, it was hit by cars. That was our big thing that killed more animals.
Not anymore.
Kind of trauma, but these chronic, cancer was not on the list at all
Yeah, that's really a change. Let's talk about that for a minute. Let's just jump in about the Lymes. I didn't realize Lymes was such a big issue in your practice. So typically when an animal comes in with Lymes and you start doing the ozone, again, what kind of benefits are you seeing? What kind of differences? What are you seeing?
Well, first of all, the Lyme disease, which is, we see a lot of Lyme and co-infections here in New England, and you see it all over the country.
Yeah.
But the ozone really is very positive for Lyme. It stimulates the immune system. It kills probably some of the spirochetes. So when we do the UVB and the ozone together, I feel like we're setting up this cascade of, we're killing some of those spirochetes within the system and then releasing that dead spirochete into the blood, and the body sort of attacking, and the system is moving, and the immune system is moving. So using the UVB and the ozone together, I think is great for Lyme. And then the owners are supporting them. And again, I use the microbiome restorative therapy, the fecal transplants, because if I can get 85% of the immune system working more efficiently by giving it a balanced microbiome from a healthy animal, why shouldn't I start there? That's like the most logical thing to do, is to get the immune system. And so many animals have been on antibiotic after non-steroidal, after antibiotic, after pain meds, after, they're on and off all these drugs, and they damage the microbiome. And if the mother was on it and the grandmother was on it, and how much of it got passed down from generation to generation, a lot was lost. It was lost 25 years ago. 10 generations before has been lost. So you've got to think about that part, is how do you get that gut flora back when you've had all these generations treated with heartworm pills. Heartworm is, the once a month heartworm is an antibiotic. So once a month we're giving an antibiotic to our animal. Is that a good thing? No, but how do we prevent these diseases? There are all these ways that we try to do in our practice to try to strengthen the immune system, prevent certain diseases, at the same time, try not to harm the immune system.
So when they're on the medication or on the antibiotics, I know a lot of owners are worried about getting them off. How do you do that in conjunction with ozone therapy?
Well, giving them antibiotics, if they have a massive infection and they're septic, I would use antibiotics. But I've done that with just using ozone and UVB on animals that had white cell counts of 46,000, and wow, they were allergic to antibiotics, and they did great. They dropped their white cell counts, they went back to normal. It's scary as a veterinarian to think, oh, I'm not using that antibiotic as a tool. And what's happened is animals that have pushed me to do that because they had severe, toxic reactions to antibiotics going into white, red cell and anemias. And, so I sort of had to do it just because I was sort of stuck, and they did really well. So is it great to mix the two together? Well, I think it really potentiates your antibiotics to work more efficiently, because you're helping the immune system get stronger. You're killing off a lot of the excessive bacteria that is causing the problem, without taking it down and completely destroying all the microbes in the body, which we need. We need the microbes in the body.
Yeah, for sure. And the ozone really helps the immune system in such a big way, but it is hard to deal with the medication versus doing the ozone. So with the last one, so we talked about the cancer, Lyme's, and then the kidney disease. You also mentioned, give us an example of, do you know any animals off the top of your head that you work with kidney disease that you've done the ozone, and how did they do?
Well, I think with kidney disease, it helps bring down inflammation of the kidney.
Yeah, because there must be a lot of pain, right?
Well, some animals do, some are just very weak, and it's not easy. I'm not saying that chronic, debilitating, or acute kidney failure is something you can turn around with ozone. Definitely is supporting. And I do it in combination with the microbiome, because that makes them less nauseous. Most of these animals are really nauseous. But once they start really getting their creatinine really high and their urines are so high and their phosphorus go up, it's a cycle that I can't say I get them out of that, but it does seem to help a lot of them. I've had several that were considered incomplete kidney failure that were told that they were going to be dead in a few days, and we've had them turn around with ozone therapy.
Wow, isn't that amazing when you see that? Wow.
Kidney function. So was it an acute insult to the kidney? And I'm sure other veterinarians might have that same success working with other fluid therapies and stuff. But I've seen enough of them that I think it's such a great opportunity to try to work with that. And then we use a combination with acupuncture and Chinese herbs and Western herbs and homeopathy. So it's not like just ozone, that's it. You know, I try to nurture whatever kitty function we have that's there, and then try to get that to allow us to give us time to get these herbs to be able to work, and give us time for the acupuncture to stimulate the chi and the vital force in the animal.
Yeah, that's a great combo. I know when I had my clinic, I did the hyperbaric and the ozone, plus like you, the herbs and the supplements, the food. Great combo when you do all that, plus detoxing. So as we're wrapping up, because of course, time is flying here. Dr. Roman, as we're explaining the ozone therapy, this is very new to a lot of people, right? What would be one thing that you want the viewers to really understand about ozone therapy and their animals? What is it that you could tell them and assure them, of course, that it's safe, but also that they could get out of it?
Well, I think it works for so many parts of the body in so many different ways, from whether it be an ear infection, eye infection, corneal ulcer, dental, gingivitis, abscess tooth.
So many things, right? Hundreds of things.
You could just go through the body and find 100 things that I could treat with ozone. Right. And so that's what you look at that and you go, God, what if I had my dog's tooth was abscessed with ozone help? That absolutely helps. So I injected jaws with it. I've injected teeth that were abscessed. And sometimes they don't. And if they don't, you remove the tooth, but you try.
But at least you try. Do you have water that they drink too? I mean, do they typically go for the water?
No, not really. I haven't had luck getting ozonating water and having them lap it up real quickly, because the ozone will dissipate after like 35 minutes and it stays open. So, and you want it sort of cold. So some animals just won't drink it. I mean, maybe if you could try putting some broth in it. I'm not sure how much the ozone will get just changed from the broth. But if you warm it up with a broth and you give it to them, it probably won't have any ozone left in it. It'll just be water. Right. So getting them to drink ozonated water has not been successful for me. But using ozonated water to flush wounds, to flush ears is fine. That's something people can do. We do a lot of ozonated saline because it's more isotonic with the system. But doing the water is another thing you can do. And then whether it's soaking paws or wounds or hot spots or infections around the toe. There's so many different ways that you could add the ozone in to any kind of cleaning and care that you're going to do for the animal. So it's pretty easy once clients know how to use the machine, and that's not really hard either to learn how to use the machine. But my feeling is you would like to work with a veterinarian that understands what you're doing, and you're not doing this without their knowledge and letting them know, because as they see your animal change, they may open their eyes and go, wow, you got that, you got that to heal. And you see in videos and presentations of these conferences, these horrific wounds that you would say, you got to amputate that leg. And they work with ozone, and predominantly ozone, and these wounds have healed. And I've seen them too, where a cat was supposed to have its leg amputated, and was told that it had to have its leg amputated. There was no way to save this leg. And the owner wanted to save the leg, and they said, it's going to be $1,700. This is already 12 years ago, right? 13, yeah. We'll amputate the leg for $1,700. We try to save it, it's $4,000, but most likely we're going to have to amputate it. So you're going to have to spend another, and now those prices are probably 30-40% more than they were back then. And they were sure they had to amputate the leg. And I said, well, just give me a week, and we'll do ozone every day, and we'll do acupuncture to try to bring circulation into the area, and we did some surgery to bring it together. And in 8 days, it was healed.
Wow, like completely healed.
Completely healed. And it was on antibiotics from the other hospital, but that wasn't what healed it. Antibiotics.
On 8 days, nothing heals in 8 days with antibiotics. That just keeps it from getting infected, but that to say that it was actually healed, that's huge.
Right. I mean, and I was shocked too, because the skin came together. Well, this was the cat got caught in a fan belt, and got got all the skin ripped off and degloved, and I
Yeah.
ended up having to move skin from up higher up on the cat and pulling it downward, and shifting, doing some little bit of plastic type of surgery, but manipulating the skin, and it healed in like 8 days. I was shocked, and the cat had its leg for its whole life, which many years. So
And so much easier. I mean, so what did you do? You had it bagged, or
yeah, we were bagging it. We were cleaning it with ozonated saline. We did what's called circle the dragon with acupuncture needles on either side to bring circulation across from it. And we did homeopathy too. And we gave it nutritional support as well.
so bagging means that you put a bag literally over the animal's leg, and then you put the ozone tubing in there so that the ozone fills up and goes there. And how long did the cat have to have something like that on?
20 minutes, and leave the ozone. And what we do is
For how long?
about 20 minutes.
Okay.
So we typically bubble that through the ozonated through olive oil. That is bubbling, so it doesn't irritate the lungs. So the cat can sit in the same room as the owner, and the owner can hold the cat, and it bubbles it through.
Yeah.
Otherwise, you can use ozone gas, but when you remove it, you've got to be sure you don't breathe it because it will irritate your lungs. So I tell people to do that with an open window on the outside.
That's what I do. I tell them to put a fan on, open the window. There's many ways of doing that, correct? I mean, that's easy, but that you put it on 20 minutes, 8 days, the cat's leg was healed. That's a wonderful story. So on that, we're going to close up the interview. And thank you so much, Dr. Roman, for your time. I really appreciate it. And I think people just need to understand that ozone is safe. It's easy to do. They go to somebody like you to get started. They could do it at home if they want to, but a lot of good ways that they could use it for the animals. And I hope that they got the information from you.
Yeah, I mean, they can obviously go to my clinic website, which is mashvet, MASHVET.com, and there are videos on how we talk about ozone and UVB, and they can watch that and the microbiome stuff that we do. We share it with everybody.
Yeah, that's awesome. They could go on there. I saw you had a lot of videos on there. So we'll have that link below. Let everybody know about it. At the summit, we'll try to get some more testimonials from you before that as well so that we could upload it. But it's definitely a viable therapy along with, like you said, using the diet, the supplements, and all these other things. It's a powerful.
I think one thing alone and only doing the ozone and not doing all the support for the immune system at the same time, you're not going to get the kick.
Effect.
You really want to get the whole body working to take care of the body.
And that's like with humans too. That's a great point. Yeah, exactly. Well, thank you so much. I appreciate it. And we'll have this available for everybody so they could see it and share it and spread the word, right?
Okay.
Awesome. Thank you so much. Thank you. Bye-bye.